Welcome to the annual medical conference of IMA. My name is Mengistu Kifle, and I'm presenting for you the telemedicine and digital health. And the objective of today's presentation, following the presentation, the participant who attended this course will understand of telemedicine in terms of definition, benefit, limitation, and key to success. Also, he will be able to discuss telemedicine implication to the healthcare system. And the other objective is to have a glimpse of what telemedicine has brought and will bring to the provision of health services, and become familiar with telemedicine in Ethiopia, because I would like also to discuss with you what are the experience of telemedicine in Ethiopia, and aware in the issue related of telemedicine toward this mainstreaming. It is very important. We have tested for the long times as a pilot level. Now, why we are trying to answer that question also, we are to identify evidence and policy of telemedicine, because one of the challenges in that area, I will explaining to you also in that area. The last one is understand issue related telemedicine during COVID-19 this period. Therefore, what are really the opportunity we have got in this one? The first thing is really, I would like to ask a question, okay? The question is, if telemedicine and digital health is a solution, if it is important, then what is the question? What are really we are asking? Therefore, entire of my presentation is trying to answer this question. Telemedicine is really recognized more than 20 years back. As you say, that World Health Organization in 1997 says that telemedicine is considered to be so effective that the World Health Organization announced it is part of health for all. Telemedicine and digital healthcare, it has a vision. The vision is connecting people to people. It doesn't matter health professional or non-health professional, health professional to health professional, or non-health professional to professionals. The second one is resource to needs. We have resources, we have also a need. Telemedicine or digitalization will bring such connection, and healthcare problem to healthcare solution. Therefore, the philosophy of telemedicine are connecting issues and solutions in the three areas. Historically, telemedicine started in 1905. I will come when we are discussing the telemedicine history, because such a kind of terminologies are existing. The first terminology is telemedicine. The second one is telehealth. Telehealth started in 1978, become of teleeducation, tele others also when they started also health as a terminology. Another one is in 1999, e-health. Electronics, commerce, electronics, other things are coming also. They changed the name to e-health. It's also, they discussed now in 2003, forward m-health. The definition and everything is we are discussing later. But this is the historical, how those names are coming in the field of telehealth and telemedicine. This is very important. Digital health. I have three parts to discuss with you. The first part is digital health. The second part is really that one we are talking about e-health in general, and specifically we are discussing in telemedicine. The first part, digital health, is the vision of digital health. This revolution initiative is that the future health care will be allow citizens to control and make use of her personal data. Therefore, the digitalization is bringing, that one, the healthcare services to patient center. The second one is definition is to create a national digital health ecosystem, universal health coverage, because people are traveling from place to place. Therefore, we are just efficiency, accessibility, affordability, timely, and safe manner we want to provide the healthcare services. That's why the digitalization is that one. It is, therefore, we need a wide range of data, information, infrastructure, and service. This is the digital health in general. What are really the current challenge of digital health? Because starting, that one, the last 20 years in Ethiopia, also any part of the world, we are starting to digitalize of the healthcare system. However, most of the application is fragmented and the stream system is not there. The second one is digital intervention capture patient data but operate isolatedly or independently. And for example, the pharmacy is not talking to medical records, the medical record is not talking with the laboratory, or etc., etc. The other thing is data is inaccessible, improperly formatted, not standardized, therefore it's not interoperable. For example, in one places, for name or patient ID, whatever we gave, another places is not the same. Therefore, we have such a kind of challenges. Another, duplication of data collection. Because the system is not communicating each other, therefore they are collecting data differently from different sources. Unique identification or patient, provider, health facility across system is very difficult and complicated the digitalization process. Lack of common data platforms. We don't have to analyze those platforms. What is e-health? I'm just enlightening you about digitalization. Now I'll try to communicate with you about e-health. What is e-health? E-health is medical informatics, public health, health services, information delivery, enhanced through internet. We can define it, that is an e-health. In a broad sense, technical development, but also state of mind, way thinking and attitude and commitment for networked global thinking to improve healthcare locally, regionally, and worldwide by using information and communication technology. This is a very important core point of this definition is really it is not only thinking locally, we have also to think globally because we have tried to communicating with our data, information, and etc. with other worlds. Therefore, that is the very important thing of networking. What is e-health? It's continue. This is the HIMSS definition, the application of internet. Still, we are not talking about local area network, but we are talking about internet. Internet is talking about globalization, any place, anywhere. Therefore, and other related technologies, ICT technologies, is healthcare industry to improve access, efficiency, effectiveness, quality of clinical and business process. Therefore, we are not just introducing a technology in the sake of technology. It has to be addressed those industries of access, quality, and other issues. Now, it is the third industry pillar of healthcare. We have to think this way. The first one is we can talk about chemistry, which is now 7% of expenses, which really that one brought to our medication. The second wave is physics, which is image devices are coming and helping the industry for diagnosis. The third pillar is showing that the e-health, 12% ICT is joins the health sector industry in 21st century. Therefore, if you see that one, most of the times e-health, that's the expensive part of the pillar. That is the second part I have tried to define for you about e-health. This is the background and discussion parts. Therefore, what is telemedicine? Today's discussion is concentrating about telemedicine, which is really historically the first, starting in 18th centuries, 19th centuries. What's telemedicine? As you see that one, telemedicine is two words, tele and medicine. As everybody knows, when the health sector started, or the medicine is at the beginning started, simply by interviewing of the patient or his family, we are just treating the patient. Second, using of certain devices we start to use. Now, the telemedicine means that one, we are using internet as our definition and giving healthcare service. Therefore, telemedicine is a remote communication of information to facilitate clinical care. That is the difference. And the other thing is, it is a tool that makes healthcare more accessible, because it's not necessarily the physician and the patient to be the same place at the same times. They can be in different places and different times, and they can get the services. The second is, it is cost effective. I will come and discuss with you how it becomes cost effective, and increase patient engagement. Therefore, if you are providing to the patient is providing you some additional information, and also he will be knowledgeable of his health care. Therefore, it allows also the care professional evaluate, diagnose, and treat patient at distance. For telemedicine will give you that one, the healthcare providers from distance to give the service. Generally, everybody is now well aware of that one, because telemedicine can be simple telephone, or your telephone using a voice and getting a second opinion or advices, up to telesurgery. Therefore, whenever we are starting telemedicine or thinking a telemedicine, we should think from the simple to the complicated one, according to the discipline we want to use. You can see that this is simply as radio communication to the telesurgery. Therefore, the American Telemedicine Association in 2010 describes that one, telemedicine doesn't have to be high-tech. There is a huge benefit in terms of keeping people out of hospital. Therefore, any possible and available technology you can use without thinking a big thing. ATA defined telemedicine, use of information forward from one place to another through electronic communication means in order to increase the patient health status. We'll discuss those definitions as we have different definitions. WHO in 1997 is that one. The whole definition, whatever definition you are seeing, is they are talking about distance. That's why the word tele is combined with medicine. What are the benefits of telemedicine? Let us to discuss about the advantage or benefits for patient. Patient, it can get access to specialized healthcare service to underserved rural, semi-urban, and remote areas. As you know that one, all types of health professional we can't have in every rural area. Name it dermatology, name it psychiatrist, and etc. It's impossible. Therefore, those people who is living or citizens living in the rural or urban centers, they can communicate and get those services. Second one is access to expertise of medical specialists without physical referral. Usually, we have to follow the referral systems. But through telemedicine, if you know that one, anywhere, any places available that services, you can log in and communicate with that one. Reduce visits to specialist hospital, because it's not unnecessary. Visit will be remaining at the location they are living. The second one is follow-up care. It can continue follow-upping through this technology. For hospitals or for the provider section, when you are seeing, it is unnecessary visit to hospitalization, special care at tertiary hospitals. This is a very important thing is for that one, because most of the case can be supported at lower levels without bringing the patient to hospital. Early discharge of patient, it is also possible, because after that the patient can go at home and can be followed through this telemedicine means. Another one is increase the scope of without creating physical infrastructure. This is a very important thing. This is the innovation now today. It's not necessarily now everywhere to build health facilities. Therefore, once you have those things, once we are believing that one telemedicine is working for specific types of purposes, we can use without physical infrastructure. I will give you several examples about those things. But we have to agree, when I'm talking sometimes about technology, telemedicine is not a technology. It is another means of providing healthcare service. Like wave 1 and wave 2, I have just mentioned in the first. Not any branch of medicine. Therefore, whatever psychiatrist is doing, the services, radiologists doing, internal medicine, pediatrics or gynae, whatever, they are doing surgery, they are the experts who are doing using technology, additional technologies. Therefore, it's no new branch of that one. It is not completely new. As I have mentioned for you, early 19th century they started to use by communicating and getting informations and giving healthcare services to remote area or other places using this one. Not a replacement of health worker. It's not replacing any health worker. It is only facilitating and using the same services as hospital is doing. What are the, if telemedicine, we define it, if you understand telemedicine, we know that on what telemedicine is not, what are really telemedicine can address in the healthcare system. Therefore, we are not driven by technology, we are driven by the healthcare issues. Therefore, what are the challenges of health system? The first thing is we have staff shortage, especially specialists and subspecialists. We don't have enough number. The second one is it is chronic condition of patients and aging people are increasing. Therefore, we should to address that one. Aging population, we have to address those issues. This is the healthcare issues. Distance between health facilities, this is another issues. Another thing is paper records. Therefore, we can't provide that digitalized health. Another thing is we have healthcare problems, non-communicable disease, violence, injuries, high maternal and child deaths, etc. This thing is we have healthcare problem. Our healthcare industry has a problem. Legal issues and etc. We have also another problem. Bandwidth issue also. That is the health issue, but we are talking about in generally when you are coming to the healthcare system, there is also a technology that one also a problem. At the cost of also purchasing or introducing telemedicine is another issue. And the last one, and the very important thing is regulations and government regulation and other things. This is a very important thing. This is the issues what we have in the challenge of the healthcare system. Therefore, we want telemedicine, really that we want to apply, how we can reduce costs, how we can really improving quality without reducing costs, without compromising of the quality of services, and increase accessibility. This is the three issues that telemedicine will addressing, okay? Why need technology? Therefore, telemedicine technology or this technology we need because we need to use the healthcare resources, infrastructure, and human resources more efficiently than we do today. What does it mean? For example, if you have one radiologist and subspecialist one, we have subspecialists, we can using by simply sending those images and he can interpret and reply to the another health sector. Therefore, we can use that one. Therefore, this is the one important thing. The second thing, we need to focus on quality of healthcare services. If you want to provide a quality of healthcare services, for example, in primary healthcare, we don't have any, again, I'm giving an example of radiologists. If you don't have a radiologist, the image will be interpreted by radiographers or by GP. But in that case, we are really compromising the quality of the. If you are sending those images, for second opinion and for consultation, it will improve the quality of the services. Another thing is, we are just providing a new health delivery channel. Therefore, such a kind of services, rather than the referral system and other things following, we can use it by this network, okay? History of telemedicine is talking that one. Just I'm trying to tell you the history because it's very important when we are discussing about why the technology is not accepted and diffused like that one. In 1906, ECG, they communicated. When we come in 1920, Gutenberg advised through radio. If you are coming in 1950, X-ray interpretation through tested. In 1910, they started to use telephone network and PC introduced. After that, ICT advanced, internet is 2000. Therefore, the telemedicine history is like this one. It started more than 100 years back. Therefore, why telemedicine? Because this is the very important thing for our today's discussion. Still, we are talking about telemedicine really at what stage? In 20th century, you can see that one, video chat programs, healthcare goods, mobiles, and other devices came, therefore it is okay. And now today, telemedicine is, most people have access to basic telemedicine services, especially in the USA, Europe, Asia, and others. Also, in big number also in Africa. What type of telemedicine service we can get? The first type is live video. It is two ways of communication. It can be healthcare provider to video conference or personal like Zoom. Using those things, people can be consult each other. It means they are in the same times and the same different location. When you are coming store and forward, you just store the data and sending to the specialist or to other colleague for interpretation or consultation. The third type of telemedicine services, remote monitoring. Using mobile or use of connected electronic tools, record personal health and medical data, and viewing to another things, especially using those mobile types of devices and collecting those information. The last one is a mobile health practices today we are using for education, for clinical practices like our smartphone, tablet, and PDAs. Therefore, this is the four types of service we can get using telemedicine. The service of telemedicine can be using those devices. It can be teleconsultation. Therefore, the medical specialist, second opinion, professional to or to patient. He can give a second opinion to the professional, healthcare professional to healthcare professional, or healthcare professional directly to the patient. Okay. The second one is we call telediagnosis. It means specialists diagnose based on received information. It means, for example, if you are sending an pathologist images or dermatology images, they can diagnose and they can tell you and responding. The third one is telemonitoring. We can monitor patient distances using wearable or mobile devices like heartbeat, blood pressures, and etc., etc. And the last one is, and very important, nowadays, mostly they are using for CME and collaboration with colleagues. Therefore, you can use one of the previous types of services by using this one. What are the technology involved? Therefore, we want to give this provide types of service. What technology we are applying to these technologies? First and the most important thing is all the times we have medical instrument, or in other words, we have medical devices, which is existing in hospital, or which really that one can be a portable type of devices at home or any parts. The second is telecommunication technology. That is very important to transfer data and any images or vital information from one place to another places. The third one is information technology. It means in that cases we need a software or application that really communicating as a protocol of those devices and those network. I'm just giving you what is really in the telemedicine commonly used devices. Those are really that one devices which is ranging less than 200 and 300 US dollars, and we can give these things to primary health care. Digital ECG, it can be the ECG from one lead to different types of lead, electronic stethoscope, high resolution camera, microscope, X-ray digitalization, etc., etc. Digital camera is also including as a medical devices. Look at, for example, this is MD200 general examination camera, which has such a kind of things. You can use it for multiple purposes. All those purposes, what you are using is using that MD2000 types of camera, which is costing less than 200 USD. And we have also such a kind of ECG machines, simply portables, and also wireless. You can use those things for different purposes. I'll show you also some portable ultrasound machine, which is really that one be connected and using. Another mobile-based devices nowadays frequently using. Look at the mobile. It's attached with otoscope. You can view and click a mobile portable eye exam. Simply we have the software. We can take the pictures and that one. It means as simple as that one. We can give these things to primary health care and health center and other levels of users. Another thing is even though for oral cancer detection, he's using his mobile apparatus attached with small devices to look the images. You can see that also the thermometers we have attached automatically to send and reading in another places or in your laptop. You can see that one heart monitoring types of mobile apparatuses. You can see wearable or whatever devices which can give you those days monitoring our health. Another thing is nowadays non-invasive blood glucose sensor we have. Those sensors is simply they will tell us that one how our glucose level. Blood pressure monitors also we have in our watch. Therefore, these things are really, all those things are medical devices which is easily integrated and used by professional or non-professional users of the system. In other words, it's a patient. For telemedicine application, it can be phone consultation, is there also electronic data transfer and second opinion, store and forward, remote monitoring in patient using those information, two-way video, remote control, and other things we have, and remote control surgery robots and etc. This is all those things. Service can be, all clinical service can be used for these purposes. It can be cardiology, it can be psychiatry, it can be oncology, it can be anything can be applied in telemedicine. Therefore, this will show you that one we can use by one devices and multiple purposes. Professional consultation, we can do it by telephone or we can do it by video conference, or diagnosis, we can use by video conference or store and forward and etc. This is very important when you are selecting any type of services applying telemedicine. It depends with you what are the most cost effective and available and low devices. This is the same thing is application area, it is interface, medical devices, communication infrastructure. This is summary of what I have talked and discussed with you. Standards and outcome. The whole thing is telemedicine is to reduce costs, to improve quality, to expand access. Therefore, whatever you know that one intersection you are doing, the ultimate goal is the improve the healthcare outcome. If this is telemedicine, it's good. If it is applicable, if it is also so cheap using the voice communication up to telesurgery. Therefore, what are the issue of adoption of telemedicine? Starting 1905, today, what happened? What are the challenges? Therefore, there is very important theories. Rogers' theories is diffusion technology in general in 1995. When we see that theory, telemedicine diffusion curve in 2003 showing that one, does it work? We don't have now a proof of concept. It is working. I will discuss also in Ethiopian examples. The system is working. Okay, if it is working, the second question, is it cost effective? Applying that technology, if it is even though working, it is really cost effective? Yes, it is very cost effective. We'll discuss also that one. Another thing, how widely spread. It means, in other words, how it becomes a business model. Because this is a Rogers' theory of S curves. It dictates that one for you. You have to use that one. Where we are discussing in the next slide. Telemedicine maturity model. Therefore, if we say that one, the diffusion curve is showing us that one, what are the maturity model? Core readiness. It is planning and integration. Whatever telemedicine system is applying, we need the first thing is a planning and how we are integrating. In Ethiopian case, we have HSDP and HSTP. We are integrated that one. We want to apply. The second thing is technology readiness. Availability, reliability, affordability of ICT and related infrastructure. Yes, in Ethiopia also, from the dial-up, we reach in the broadbands. This demand is not stopping today, because tomorrow also we have additional that one. But the health sector, we have HealthNet technology. Learning readiness, resource to provide training using the technology. Really, we need a budget. If you want to spread these things, if you want to apply in the healthcare system, we should to provide training programs and in the every levels of education. The last one is policy readiness. Policy at government and institutional level, it is very important to start those maturity level. You know that one, these cars, the first cars in Ethiopia, which is really in the car industry, even though we are importing that cars, after that, we start to produce different types of cars in Ethiopia. Look, we transfer technologies and we are using different types of car. Why in telemedicine? Why we are lagging in telemedicine? What are our challenges? Why we are not really accepted the technology like those cars in Ethiopia? Therefore, the car, we saw it. What are the experiences of telemedicine in Ethiopia? I'll give you some examples. We have different projects. One is the ITU projects, which we started 2004, almost 19 years back. This the first project in Africa, Ethiopia, and Mozambique. Second project is IPAS, which started in 2006, which is partially in Ethiopia Black Lion Hospital, Professor Schneider used. Another is Jimma Network, which is supported by CDC and Tulane University, and Jimma Network is connecting 3 hospitals to Jimma. Another is telepathology in 2019, we already started. Second one is Pan-Africa in 2005. It means the African and Indian projects, which Ethiopia also applied in Black Lion Hospital and Metu Nekkam Hospital. The e-reference telemedicine also we have in 2014, which is applied in Addis Ababa and other hospitals. World Bank Diaspora Projects also we have 2011 and also Arise PAC system in now running. Therefore, these systems in Ethiopia mostly we used store and forwards based system and image based clinical application using digital camera and other devices as a low cost. Second is we used also ECG, PACS, video conferences. It means also we have different experiences with the red one and the blue one. Some examples, I can give you that one. This is one of the example which really, maybe I gave you several times also in most of my publication, which is really that one. People start thinking in the one hospital, tumor in the lung, but in the normal condition, that patient has to be traveled more than 510 kilometers. However, by sending images, by taking digital camera and sending images to Jimma University, it is really that one we solved the problem. And patient has saved travel expenses and time. And the physician who sent these things for consultation, they have got that one and knowledge. Another example is about telepathology. This Professor Schneider's experience, which is really rather than taking a TV and digital camera with microscope, they have sent that images and get an opinion that one and save the 17 years of boys. Another one is reference system, which is applied using E-Wave MD system, which is applied in Ethiopia using different RTech devices and consulting between health center and primary hospital. Especially this project is applied for pregnant women and controlling their blood pressures and sugar levels and etc. This is a plan of the FMO telemedicine platform design. You can see that one. Telemedicine center, consultation, education, and everything is spoken, half sites are connecting. Just this is enlightening you that one. This is image enterprises, which is really using all images and sending through the PAC system. And we have also the PAC system already applied now 22 hospital. Store image and national level starting April 2019. We have more than 600 X-rays and 100 cent for CTs, MRIs, and etc. This is also IPAS, which is Ethiopian adapter system. We have that one, and etc. Therefore, in Ethiopia, as you say that one, we have proof concepts, and also we have got some quality of services improving. But what are the lessons we have learned from all those projects? We have learned, the first thing is infrastructure. Infrastructure is an issue. Therefore, we have to improve that one, because not only the availability of the infrastructure, but the payment and etc. The second is, most of the project we used a Google or email. We didn't have an appropriate software or application. But in the last PACS, reference systems and etc., we have got also those systems. Reimbursement. Most of the service was provided by voluntarily based. Therefore, it is really not that one we have to reimbursement issues. Workflow or institutionalization. This is another big problems we have learned. After the pilot project, the project or the system is not continue because it wasn't institutionalized. Low volume of service. This is acceptance from hub site, also from the spoke site. Mostly the spoke sites, after a certain period, they are not sending the, they are not continue the consultation. This is not only Ethiopian trade, it's all over the world. Financial sustainability, reimbursement is also coming. Therefore, this is a lesson we learned. The experience, the challenge, what really is that one? As a conclusion, when you're coming, those as shortcoming or the lesson we have learned, but telemedicine is useful for remote as well as urban setup. This we have just really learned that one from the projects. Store and forward image-based clinical service more appropriate for teleconsultation and diagnosis in Ethiopian case. This is the conclusion which we are read in the experiences. Existing practice of guideline for telemedicine. There are for store and forward and etc. I will discuss with you those guidelines in the before finishing of my presentation. Existing of guide, we have reimbursement and integration of the national health system is also another issue. This is an issue really we have learned from that one. I'm trying to mention for you one another important thing is, in Ethiopia, if you want to apply the health sectors, we don't have double standards. We have one type of standards. For that, we have at our American Telemedicine Association practical guideline for telemedicine, different clinical discipline. Therefore, we can adapt those one when we want to apply. And most of our guidelines and other informations are gathered from those association websites. Also, there is Europeans and Latin America and also developing countries standards, Australia and etc. We should to adapt those standards because it has similarity to provide of healthcare services. The guideline, it has clinical and technical standards. Guideline you can find for telemedicine. Therefore, if you want to apply anything or if you want to improve your knowledge how to really use, it has a clinical guidelines. The second one is recommendation of best practices. It depends the clinical and technical specifications. For example, if you want to use dermatology, what type of really digital camera you are using or what type of pixel you have to have as a minimum requirement, what type of clinical information you have to provide for consultation and etc. The other thing is a step toward this optimizing telemedicine practices. It means how really that one multiply you can use one medical or telemedicine devices for multiple purposes. For that, they have technical specification. Okay, for example, the ATA standards, which you can really that one, I'm discussing with you one of example, how we can use stored and forward images. Select patient for telemedicine is a procedures. Therefore, when the patient is coming at primary health care, you have to have certain criteria for selection of the patient. Second is getting the patient information and his consensus that one you are providing those services. Third is suitable images and patient history. It is really that one, those image has to be really to be standard, which is really accepted by for the specialist you are sending. And after that, information, which is really important, and appropriately trained staff is very important to take the images also to send that one in both sides. Model of care and links to other services. What type of model or standard 6 is talking about the services you have to provide. The standard 7 is talking audit and quality control. And standard 8 is talking communication between refer specialist, primary care communication and whatever. This is a Scottish also. They have in different website. You can get and read about those standards, the detailed standards. If you remember, in Ethiopia context, technology is a process and growing all the time, and the clinical disciplining is growing. However, most of the times, the issue is how will be compensate the specialists. It's another word is how we can really that one reimbursement. This issue, it is not only in Ethiopia, but the rest of the world, they have solved those problems. In Europe, USA, Australia, and other parts of the world are already solved, and they have different modalities for reimburse or compensate for the service you are providing outside of your health institution. Therefore, I'm just discussing with you some example for you to refer for further discussion. because this is one of the challenges why the telemedicine is not widely used. In Ethiopia, also another part of the continent. This is the Netherlands one. We have also the USA, for example. Now they are applying, 48 states, they are applying and or reimburse for video conference. More than 20 states also, they are using those ones. That is 2060. But for this COVID period, almost all American states are adopted the reimbursement policy in both store and forward and video conference. This is a European Union directive which you can get or getting service, the patient can service or the provider get money through that services. In Ethiopia, we have really to address some of those issues of telemedicine as a backbone. We have this 2050-27 Ethiopian path to universal healthcare through strength of primary healthcare services, really that addresses or the importance of the issue of innovation and use of technology like telemedicine. Therefore, the government already recognized that one in his vision, that one telemedicine is important part can play with the universal health coverage. Second thing is the technology vision of for health, ICT, medical technology to deliver health care. We can apply those things and family. And another thing is mentioned that one, in that one is to really to retain the professionals also to the quality of service. CME can be provided through telemedicine. Teleconsultation program also highlighted in the vision. The HSTP also, ICT infrastructure, developing ICT infrastructure like HealthNet, computer and accessories. It's really that one, using this one applied. Now also in the second phase we have digitalization of the healthcare system. ICT platform, different types of healthcare is highlighted there. E-health strategy also is extended, this one also. E-health standards, infrastructure, governance, implementing services, educational promotion, and human resources support. This thing is already in the plan of the ministry. Another thing is teleradiology concept paper or the roadmap already prepared by Telemedicine Teleradiology Association and experts from St. Paul and Black Lion Hospital, and referral and clinical services to provide using teleradiology, improved efficiencies, and medical researches, web partnership, standardizing, and education. Therefore, you can see that one, we have different strategy, policy, guideline documents which is adapted from the international documents. And the Federal Ministry of Health also start to work also, is not finalized, but the reimbursement document also prepared. These things are very important, you know that one. Now after this discussion, maybe anybody who is really that one to start in his institution or to start any services to understand what existing in Ethiopians as a strategy. And another very important, the COVID-19's last years when as an opportunity for the medical field, specifically for telehealth, they used that one and prepare a telehealth guideline, which is really to provide the services. When the service and the providers are disconnected, they just prepare these guidelines to continue the services. The purpose is to ensure continuity of care for chronic care patients, clinical practitioners providing assessment, treatment, and consultative service via technology, and to assist education and consult remotely clinicians to provide safe and effective clinical care. This is really that one which a big achievement in not only in Ethiopia. I'll discuss for you that one, the opportunity of COVID-19 for the telehealth service in others, the next slide. But in Ethiopia context, understanding that one, we just have got also this guideline which is giving you access to start your service. We have another related guidelines, telepathologies, health, information revolution, digital health ecosystems. All those things are really trying to facilitate the use of telemedicine in Ethiopia. What are really that one? If we have those guidelines, what are really they blocking toward this not to start in the mainstreaming of telemedicine? This is the first thing, is current lack of integration within and between care provider, because this is a very important thing, how really that one we should to create such a kind of linkage. Second one is scaling up. You need more than champion. We have to institutionalized organization, health facilities. They have to have their own finance, or how to pay for consultation, or how to provide services and get reimbursed. Another thing is business case is essential. Therefore, anything is to be succeed, we should think about this model. Therefore, for mainstream implementation, we need new rules about governors, how really that one are communicating to hospitals, how really that one ownership of organizational challenges, who will be on what type of hub and spoke sites, what type of data, information, and etc. Cultural attitude. We should to change users' cultural attitude. Here the users are the health professional attitudes. Therefore, I'm just stopping here and just summarizing. We have really that one trying to use telemedicine in Ethiopia, piloted in Ethiopia. We have also done several researches, and we learn where is really the gap is that one. Therefore, also we know that one there is also outside several standards which can be adapted easily in Ethiopia. Also, we understood that one there is also low cost medical devices which can really applying for our telemedicine. Also, we have really different types of application, open sources, which can really we can adapt and use as system. If this so, the theme of this year's of EMAP is talking about COVID-19. Therefore, I'm trying to talk a little bit about how telemedicine in COVID-19 period. What really that one? For most of the European, Australia, and America, took it that one, it is an opportunity. Therefore, I'm seeing these things. The first thing is, how did we implement telehealth or telemedicine during COVID-19? What were opportunities and challenges, really that one, by implementing those one? Really the previous challenge, previous opportunity existed, or during the COVID-19 period, a new opportunity and comes, and also what are the challenges? What is the future direction of telehealth after COVID, also the COVID periods? Therefore, telemedicine in the COVID-19 period, the first thing is that one, Johnson said that one, telemedicine has, in Journal of Medicine, telemedicine has always had the potential to improve access and reduce the cost, starting from the beginning. However, because of the coronavirus disease pandemic, telemedicine has now become a critical way of delivering clinical care, because one of the COVID-19s is really that was separators or contacts, minimizing of the contact patient and providers. How we implement telemedicine and telehealth during this period? People, think about all the people. It means the patient, community, staff, and call center, who is scheduling appointment, who is really programming our communication. Before that one, the patient was coming to you and seen by you. Now, we want to communicate it through telemedicine. Therefore, who will be scheduling appointment? Who is registering patients? It means if you have anything is following and etc. Therefore, we really that one, who is doing the triage and screening to provide these services. Therefore, this is, we should to see from the people perspective. In process, how really that one, the staff communicate with another, do really that one using text message for communication to provide that services regarding the patient, Zoom, some other platform, we should to select, okay? And the other technologies, really that one during this period, most of the times, in most part of the world, because we are involving the patients most of the times, we are using free version and inexpensive version of devices. Also, fast and easy to set up patient and provider, like your mobile apparatus and etc. Look for a system to call patient from the platforms. It's very important when you are communicating, anything happen, rather than calling another calling devices, try to use also those calling devices. This is really that one. Potential use of telemedicine or telehealth during this period is screen patient who may have symptoms of COVID-19 and refers as appropriate. Therefore, one, you can use it for these purposes. Second, low risk urgent care for non-COVID-19 condition. We can use it for these purposes. Medical consultation, assessment, and referral to other area, we can use this system. Another is provider and special for chronic health condition, medication management, okay? Patient is not necessary to come to this one. We can manage and etc. like that one. This is the area, some of the area, additional to existing telemedicine services. What are limitations to consider? We have really privacy limitation. Therefore, we should to consider these things really as important. The second is limited access of technology devices, connectivity issues, and etc. Therefore, we have to have a backup. If you really that one, we are communicating by Zoom. Let us also to have a telephone communication also, if in case of internet or anything things are happen. Another one is level of comfort with technology for healthcare personnel and patients. This is another big challenge. Really, people to be adapted and using is very important. That one to understand and gradually to implement. Cultural acceptance of conducting virtual visit. We believe that one really the patient may we know accepting you that to get the service by such a kind of devices because they want to come to be seen by physicians. What are the challenges? To avoid those challenges, we have to create efficient virtual workflows. This is virtual workflows. We have the traditional workflows. Now that traditional workflows has to be changed to virtual workflows. Another thing is understand what telehealth virtual visit is. It is important. It means educate the patients, educate the health providers how the system is working. Another technology deficiencies. Understand the patient technology deficiency and work with the easy, accepted and comfortable types of devices to use by patient. This is a lesson learned from the COVID providers. This is a literature finding. The first important thing is have a training before you are starting any telehealth or telemedicine service. Be assured that one you have a technical support in case of any failure of the system. Patient communication protocol. Develop a patient communication protocol. That is very important. For example, if the patient you want to meet it at 9 o'clock, somebody has to be arranged for you before 9 o'clock and sending reminder. Also send every necessary patient data in front of the consultant physician, etc. Please refer the telehealth guideline for this one. Equality, technology urban, rural, because equity is another very important issue to be addressed. Reimbursement. Therefore, once you provide those services, how really that on primary health care and tertiary hospital, physicians are communicating, investing their times, how really you want to be paid those physicians which is at tertiary hospital. Therefore, when I'm summarizing these things, in the COVID era, where are we now? In terms of telemedicine, in terms of telehealth, in terms of continuing medical education, consultation, diagnosis, monitoring, and etc. Different types of technology, and etc. Where are we now? A solution of telemedicine is piloted in Ethiopia. In other countries already reaching the stage of mainstream, and West experience has documented. Therefore, we have those documents in Ethiopia, also in developing country or other part of the world. Therefore, when we start any telemedicine, we have experiences about this one. Therefore, in terms of technology, in terms of process, in terms of guidelines. Second thing, where do you want to be? We want to provide quality of service for all citizens. Therefore, establish quality treatment schema. Therefore, how can we really provide for urban, rural, or for all types of society? How we can reduce the cost and improve accesses. Also, how we can provide for the health professional or human resources continued professional development. We want to be provided through this system like that. I am just conclusion. I will give you that one. Telemedicine could be understood from the simplest of use of technology. Therefore, we discussed a lot of thematic area, and therefore now we let's to summarize what we want to say today or to communicate with you. The first thing is that one, telemedicine could be understood from the simplicity of use technology, using your mobile apparatus, starting from that one. Second one is, telemedicine should be seen as part of the healthcare delivery system. Otherwise, it's impossible. You have to really that one, providing face-to-face or telemedicine has to be the same level, you have to bring it. Second thing, telemedicine is just another way to practice what one already knows how to do, but through new means. This is the same thing as the health professional is the one they are using systems rather than traditional ways. Through using telemedicine is a new means of providing healthcare services to the patient. Okay? Therefore, it's important to emphasize that telemedicine and digital health is not a substitute for face-to-face medical practice. It's not replacement. It is part, but rather it is tool to complement the current healthcare delivery in Ethiopia. Therefore, please think like this one. It is not substitution. It is really a complement, or it is another way of providing healthcare services. Another thing is really that one, we should think that one, telemedicine is not able to solve all the problems, the healthcare system. We should think that one. We should think that one. But the problem of the healthcare system cannot be solved without telemedicine. We have plenty of healthcare problems. You remember, I've just discussed this, aging people, chronic disease, quality of service, etc. But telemedicine will not solve that one. We have to prioritize what service we can provide by telemedicine and which one will be not solved by that one. Then, the government has different strategies, not only in Ethiopia, global strategies like universal healthcare services. We should work towards that one. I thank you. This is my presentation. Now I will accept any question and discussion pointers.